Hi everyone, welcome to part 2 of module 1. Here we'll be looking at specific AmiPro and Metagenics products that can be used within the 5R gut restoration framework. So if you recall, the first R in that step was remove. And here we were looking at the removal of pathogens. I'd like to highlight Candibactin AR, which is a blend of 4 different active ingredients. We have the red thyme oil combined with oregano oil, sage leaf and lemon balm leaf extracts, making this an excellent choice against microbial imbalances. But those ingredients are also active against viruses and parasites and bacteria. And because they are volatile oils and the aroma of these oils rises, it also has benefits for respiratory concerns, so those suffering from allergies or asthma. As you know, often allergies and asthma is driven by gut problems, as we learnt in part 1. So this is an excellent choice there. Typically, you're going to be taking one soft gel 3 times a day, just before meals, and it comes in a container with 60 soft gels. What can also be very beneficial is to combine the Candibactin AR or alternate it with another Candibactin formula, the BR. This formula differs in its formulation in that it is a combination of berberine, which is derived from Coptis and Oregon grape. It's also then combined with ginger, Chinese licorice, and Chinese rhubarb. This, if you recall, berberine has got potent antimicrobial effects, and the licorice and the rhubarb are also effective against bacteria and parasites. So typically this formula is selected more if the symptoms are more to do with bacterial infections. Often they present more in the lower bowel. So the Candibactin dosing, you're looking at taking 2 tablets before your meals. So that would be 3 times a day. It comes in a container of 90. And so therefore there's 45 servings. So it might be a nice idea to alternate between the Candibactin AR and the BR if you haven't done a specific stool pathology to know exactly what you're dealing with, but they definitely do complement each other. Another option from the AmiPro range, which isn't included in this presentation, that might be a very nice choice is Citricidal Plus. This formula combines Artemisia, Chinese wormwood, and berberine, giving the formula potent antibacterial, antifungal, and antiparasitic properties. So that's another option if you're looking to get rid of pathogens in the gut. Of course, part of the remove phase is also elimination. You want to be sure that you are killing the bugs and then able to eliminate them from the body. Ultra Fiber is a great choice because it is combining low allergy potential fiber sources such as rice bran, beet fiber, oat fiber, apple fiber, and it will assist patients who suffer from occasional constipation and won't irritate the guts. So if they've got any gut concerns and they might be sensitive to things like psyllium or corn-based products, this is a great option for them. Typically, per serving, you're going to be getting 5 grams of insoluble fiber and 1 gram of soluble. There are 38 servings per container. Magnazone from the AmiPro range is also an excellent choice, which I quite like in that it obviously eliminates contents from the bowel, so cleans it out. But it also, because of the action of the the active ingredients, the magnesium oxide and the magnesium hydroxide, they combine to release oxygen and ozone into the gastrointestinal tract and the colon. And so this provides an aerobic environment which is beneficial to aerobic flora, which are desirable, but inhibitory towards your anaerobic, undesirable flora. So it can be useful in actually eliminating candida, in addition to aiding with cleansing the bowel of waste. We've got two options available in the Magnazone, either capsules, which comes in a 60s or a 120s, or the powder. Now, the compound requires an acidic ingredient to liberate its oxygen. So in the case of the capsules, lemon bioflavonoids are incorporated into the formula. However, in the powder, you need to add the lemon afterwards. So typically, you would put a teaspoonful of the Magnazone powder, which has no taste, it's not unpleasant at all, into water, and you would drink that down and then squeeze half a lemon into the same glass and mix in the sediment and drink it down. Typically what you're going to find is if you utilize the formula in the morning on an empty stomach, you need to wait about an hour before you eat breakfast, and within 2 to 3 hours you'll experience a loose stool. It's not uncomfortable and it doesn't cause cramps either, which is quite nice. This is a product that you don't need to use every day, particularly after you've done your cleanse. You could use it for maintenance once a week. Ultraflora Acute Care is a treatment probiotic formulation from our Ultraflora range. What is so useful about it is that it combines the yeast organism, the beneficial yeast, Saccharomyces boulardii. In one capsule, you're getting 5.5 billion organisms of the Saccharomyces boulardii, which is very high. And together with that, we're getting the Bifidobacterium lactis, HN019, and the Lactobacillus rhamnosus, HN001. Those two probiotic strains have been found to enhance your immunity, particularly as it pertains to natural killer cell activity, your ability to fight an infection. So Ultraflora Acute Care is an infection-fighting probiotic. It's an excellent choice if you are dealing with any unwanted pathogens in the gut. It's a dairy and gluten-free formula, and typically dosage you're looking at 1 to 2 a day. It comes in a bottle of 30s. Right, so that brings me to the second R, replace. And if you recall here, we want to replace things that might be lacking, which might be hindering adequate digestion and assimilation. Digestive enzymes are one thing to consider, and azeopangan is a porcine pancreatic concentrate formula that is available as azeopangan, or as you can see here, azeopangan extra strength, which is basically triple the strength of the regular version. So these porcine derived enzymes are very sensitive, and therefore it's important that they need to be handled carefully under special conditions so that the enzyme constituents are not destroyed. And in order to ensure that the levels stated on the label are actually what you are getting in the tablets, we have analysis performed by a third-party laboratory confirming the quantity of the various proteases, amylases, and lipases. The formula is available in a bottle of 90s, and with the extra strength, you only need to take 1 tablet with a meal. With the azeopangan regular, up to 3 tablets with a meal. Now, if the thought of using porcine pancreatic extracts is not something your patient likes, we do offer plant-based enzyme support. Spectrazyme is a broad spectrum of non-animal derived enzymes, which includes an acid-stable lipase and 3 different proteases that are chosen to provide activity across a broad spectrum of pH ranges. The enzyme blend, the microorganisms have actually been fermented on a media containing milk, wheat, and soy, and therefore I need to mention that any patients with severe milk, wheat, or soy allergies may not be candidates for this particular formula, but no other milk or wheat or soy has been added outside of this fermentation step. Just wanted to bring that to your attention. Typically, directions, you're looking at taking 2 tablets with a meal, and this comes in a bottle of 60s. Another plant-based source is our Metazyme, which actually has enzymes that are derived from a fungal organism, Aspergillus oryzae. And these enzymes present include proteases, amylases, lipases, and cellulases. They can help to break down your carbohydrates, protein, fats, and plant cellulose. It also contains milk, wheat, and soy due to the fermentation step as mentioned with the Spectrazyme. Dosage, you're looking at 1 tablet with a meal, and it comes in a bottle of 90s. Digestozyme is another very popular enzyme formula from the AmiPro range. It is also all plant-based that has a broad variety of enzymes and cofactors that can help to break down protein, carbs, fats, and fiber. Examples are your proteases, amylases and lipases, cellulases, invertase, which breaks down sucrose, lactase, which breaks down milk sugar. Alpha-galactosidase is quite a unique enzyme which breaks down the complex fibrous membranes found in vegetables, whole grains, and legumes. A lot of people don't tolerate those fibrous membranes. They are actually fermented in their colon, and it leads to excess gas and bloating. So the alpha-galactosidase in this formula can definitely help if anyone has those kinds of intolerances to legumes or whole grains, for example. There's also a blend of phytase, hemicellulase, and beta-glucasenase. They work to disrupt the cell walls of herbs and vegetables. What I like about this formula is that there's also botanicals been added that complement the formula. Examples are papaya leaf, which is a natural source of the proteolytic enzyme papain, fenugreek, which helps to relieve stomach pains and stimulate liver function and pancreatic secretions. It's also got anti-gas and antispasmodic activities. Peptidase and bromelain, which support protein digestion. Angelica, fennel, and rosemary, which are antispasmodic. And parsley and peppermint, which are also anti-gas and help with overall digestion. So Digestozyme is available in 2 different sizes, a 60s and a 120 capsules. Right, the replace phase also will consider hypochlorhydria. If you suspect hypochlorhydria, Metagest is an excellent stomach acid replacement which combines betaine hydrochloride and pepsin. If you recall from part 1, it is important to determine individual dosage requirements by gradually increasing the dose of the Metagest, 1 tablet, day 2, 2 tablets with the main meal, if you recall, and then you subtract 1 and get your individual daily dose. This is to be taken with the main protein-containing meal. Important to note here that if there's any stomach discomfort associated with the Metagest, one should stop using it, because if there's any gastritis or a duodenal or a peptic ulcer, the Metagest is definitely going to aggravate it. You would need to first initiate some healing and eradicate the infection before you could look at replacing low stomach acid levels. So yeah, typically the dosage you're looking at between 2 to 5 with each meal, and the Metagest comes in 1 size that is 90 tablets. I'd like to mention that the betaine hydrochloride content is nice and high. In a serving of 2 tablets, you're getting 1,300 milligrams and 90 milligrams of the pepsin. Lipogen is our lipotropic formula, which is intended to support those patients who have problems with fat digestion, bile flow, bile synthesis. It combines various nutrients that are involved in fat metabolism. This includes inositol, choline, and taurine. And then we've got a number of other vitamins and herbs that are shown to support bile flow and healthy liver function. This is your chickpea and your artichoke. Typically, you're going to be taking 2 tablets with each of your meals, and the Lipogen comes in a formula containing 90 tablets in a bottle. So you'll get 45 servings from a bottle. Right, the reinoculate phase. Remember, here we are looking at microflora addressing dysbiosis. So the Ultraflora probiotic range gives you a number of excellent choices that combines a variety of identity certified strains. This is an important fact to consider because if the strains are not identity certified, you can't be sure what properties they're going to exhibit. So we periodically test the various strains to make sure that they haven't gradually altered over time, and we also select strains that are stable, meaning that they are stable at room temperature, although we do ensure cold chain storage and transportation of our formulas just as a quality control to ensure that the probiotics are never exposed to excessively high temperatures. They are high potency, so the levels differ between the different formulations in which strains are used, but those are supported by what the research shows as being therapeutic levels of the organisms. And we have a range available that utilize the different strains depending on what application you want to use it for. So here you can see the range of daily formulas that we offer, as well as targeted support and a multi-mechanistic formula. I'm going to focus now on the daily support formulas, which combine the Lactobacillus acidophilus NCFM and Bifidobacterium lactis BIO7 in a 50-50 ratio. These two strains are derived, they're present in the human intestinal tract, so they're strains that are shown to be present in humans, and have been shown to be ones that are able to exert a positive benefit if consumed orally. So they can survive intestinal transit, they can adhere to the intestinal epithelium. These strains have also been found to have a broad range of benefits that range from immune modulating to digestive support, particularly lactose digestion, to preventing colonization by pathogenic microorganisms. The Ultraflora Balance is a dairy and gluten-free option that provides 15 billion live organisms per capsule. Typically 1 to 2 capsules a day is sufficient to get the benefits. We currently offer the Ultraflora Balance in 2 sizes. Please ignore that last bullet. We offer a 30s and a 60s, not a 120s. All right. The Ultraflora Immune Health is a slightly different version of the Ultraflora Balance. It is also an encapsulated formula, but together with the 2 probiotic strains, they're exactly the same. We've added immunoglobulins derived from whey protein concentrate. It's been shown that immunoglobulins can be very beneficial in supporting an immune response when people have impaired immunity. So if you're looking for that added immune support, Ultraflora Immune Health combines these immunoglobulins with those 2 identity certified probiotic strains. This is a gluten-free formula, although technically not dairy-free, because the immunoglobulins are derived from whey. Ultraflora Synergy is a powdered probiotic formula that combines the Lactobacillus acidophilus NCFM and the Bifidobacterium lactis BIO7 with the prebiotic FOS, fructooligosaccharides. So typically, one would take a quarter teaspoon, which is the equivalent of one capsule. This would provide 15 billion live organisms of those probiotic strains, together with 1 gram of the prebiotic FOS. It's actually very easy to take this formula. You can mix it with water or any other beverage, as long as it is not put into any hot beverage. So it's great for anybody who doesn't like to swallow capsules or would benefit from the added prebiotic components. This is a dairy and gluten-free formula. Ultraflora Advanced is also a powdered formula, and here we've combined 3 elements: the probiotics, 15 billion organisms per quarter teaspoon. Together with the probiotics, we've added the prebiotics, the FOS, and we've added the immunoglobulins from the whey protein concentrate. So the advanced is really combining many of the previous formulas all into one. This is a gluten-free formula, again technically not dairy-free because of the immunoglobulins, and it's available in a 50-gram powder. You're going to get 68 servings out of the advanced. You typically use 1 to 2 servings a day. The Ultraflora IB is one of our targeted formulas. IB referring to irritable bowel. Here you can see that we utilize the same strains as in the previous formulas. However, the potency has quadrupled to 60 billion live organisms per capsule. At this high potency, it's been found to be very effective at modulating many of the predominant symptoms associated with irritable bowel syndrome. These include abdominal discomfort, bloating and cramping, bowel irritation, and urgent bowel movements. So consider using Ultraflora IB if someone is having a flare-up of irritable bowel syndrome. Any of the previous formulas mentioned, the daily support formulas, could be considered for daily support and prevention of recurrence. The Ultraflora Spectrum is a new addition to our Ultraflora range. It combines 7 different probiotic strains to reach a potency of 30 billion colony-forming units per capsule. You'll recognize some of the strains: Lactobacillus acidophilus NCFM, Bifidobacterium lactis BIO7, and the Saccharomyces boulardii. Some additional B. lactis strains have been added, as well as a Lactobacillus plantarum, a Lactobacillus salivarius, and a Streptococcus thermophilus. This strain is indicated when someone needs a more comprehensive approach that is going to address intestinal irritation, pathogens, immune health, and digestive support. Someone who is very, very depleted, it could be an excellent choice to start with, just to get multiple areas addressed simultaneously. It is a dairy and gluten-free formula, and you will be utilizing 1 capsule a day, so it comes in a bottle of 30s. This is a month's supply. I just wanted to highlight that we do have a number of supportive materials on the probiotics range which could be requested from your AmiPro rep. You'll see a poster, a clinical applications at a glance, which summarizes the various probiotic formulations and their applications, the probiotics brochure, which can be used as a handout in your waiting rooms, and the program guide for Foundation Gastrointestinal Health is a very useful outline which will cover various dietary aspects and the use of the Ultraflora probiotic in restoring the gut to optimal functioning. All right. This brings me on to the 4th R, which is regenerate. Glutagenics is a powdered formula that combines 3 key ingredients. The amino acid glutamine is combined with deglycerized licorice and aloe. This is a very making it a very useful formula for feeding and nourishing the colonocytes and also soothing the mucous membranes. You are going to get 3.5 grams of the glutamine per serving. The deglycerized licorice essentially means that the glycyrrhizin has been removed and will not have a negative impact on blood pressure. So even people that are hypertensive may benefit from this formula. The aloe leaf also has had the bitter principles removed so that the aloe does not have a laxative effect, but rather just the soothing properties remain. It's very easy to take. There is a scoop inside. You mix that into water 1 to 3 times daily. This is a gluten-free and vegetarian formula, and you will get 60 servings from a container of the Glutagenics. Another great option for the endorphin is another great option for regeneration is the endorphin, which is a powdered formula that is targeting specifically gastric health. It addresses the gastric lining by providing plantain, astaxanthin, and phosphatidylcholine, which help with mucus production in the stomach. The green tea and arabinogalactans are prebiotic factors which support healthy microflora proliferation, and they selectively feed the lactobacillus and bifidobacteria. Cinnamon and green tea extracts promote microflora balance as well, while rice bran fiber is another prebiotic in this formula that will support the good bacteria and reduce beta-glucuronidase activity. If you recall, that is an enzyme which is upregulated in the gut when there is dysbiosis. Upregulation of this enzyme will essentially mean that toxins that are dumped into the gut are reabsorbed at a higher rate. So you definitely want to downregulate this enzyme's activity. It also contains the antioxidants cinnamon, astaxanthin, and vitamin C, which further go on to support the gastrointestinal mucosa. So this is a great choice for anyone with atrophic gastritis. It's really going to support reducing inflammation and healing of the gastric mucosa. Now onto a unique category in the Metagenics range is our medical foods, which are targeted formulas that have therapeutic applications for the management of specific conditions. In the case of GI Sustain, it has been specifically developed to help patients that have leaky gut syndrome. Its formulation is designed to support intestinal mucosal integrity and promote the growth of beneficial bacteria. It does this by providing nourishing ingredients such as zinc gluconate and L-glutamine. It also contains the prebiotic IMO, isomalto oligosaccharide, which selectively nourishes your good bacteria such as lactobacillus and bifidobacteria. It is a low allergy potential formula comprised of fortified rice protein, and is formulated to exclude any of the potential allergens or inflammatory trigger foods. So it is really an excellent way to support the patient whilst they embark on the elimination diets. Typically, one would blend, shake, or stir 2 scoops of the powdered formula into 250 ml of cold water or juice twice daily. It is recommended for sensitive individuals that they start with a lower dose, only half or 1 scoop in water for the first couple of days before gradually building it up to a higher dose. Sometimes when their guts are very compromised, they can react negatively. So it's a good way just to get them used to the formula first. Another great option for the regeneration of the gut is another medical food, which is Ultra Inflam X. Basically, this formula is also designed to initiate healing in the gut, but it has further actives added to it in the form of ginger and rosemary and phytonutrients, rutin, curcuminoids, and quercetin, which have been found to reduce inflammatory compound production and therefore make the Ultra Inflamex especially useful in managing the pain associated with inflammatory bowel disease. In addition to supporting the gastrointestinal mucosal integrity, the high antioxidant content means it protects the gut from excessive free radical generation, and also specific nutrients support phase 2 detoxification. It's also a rice protein based formula, meaning it has low allergenic potential and is formulated to exclude many of the allergenic or inflammatory foods. You would utilize the Inflamex in the same way: blend, shake, or stir 2 level scoops into chilled water or juice. And again, one would consider gradually introducing the medical food at a lower dose first in your highly sensitive individuals. To make things a bit easier, we have got this patient guide or program guide, the 5R GI Restoration Program Guide, which you could request from your representative, and you will be able to see all the guidelines as it pertains to utilizing the medical food, gradually titrating the dosage upwards, the eating guidelines, as well as exercise and stress management. So it's really a nice, well-rounded, comprehensive protocol to help your patients get back on track. If you recall, part of the regenerate phase was also heavily dependent on the appropriate use of omega fatty acids. So I'd like to introduce you to the Omegagenics range from Metagenics, which is a range of oils that are utilizing pharmaceutical grade raw materials, and which have been ultra refined and are purity certified by a third party, where they test for over 220 contaminants. So the oils are proven to be free of pesticides and a range of heavy metals. They are also stabilized by a proprietary antioxidant blend, and the levels of the EPA and DHA are also guaranteed to meet label claims. Here you can see the range that we do from the Omegagenics range. General Health provides an EPA DHA 300, which utilizes the omega in triglyceride form. This is okay for overall health, but by far and large, the Omegagenics EPA DHA 720 is the best value for money formula. One soft gel is providing you with 720 milligrams of EPA DHA combined in a 3:2 ratio. Another option for inflammation, I would highlight the Omegagenics EPA DHA 2325, which is a liquid formula providing 2,325 milligrams of EPA and DHA per teaspoon. You typically get 30 teaspoons per bottle. So this is an excellent choice, and because all of our Omegagenics formulas are lemon flavored, the liquids are actually quite palatable. Yes, so there's a number of ones to consider from our range, depending on what dosage requirements you are wanting to reach in your patients. This brings us to our final and fifth R, the relieve step. If you recall, we mentioned that there are specific herbs that can be used to relieve spasms and gas and bloating, and in Intersol we combine peppermint oil with English lavender oil and chamomile, which have relaxing and stress relieving properties. So think of Intersol as an antispasmodic gastrointestinal support formula. What is beneficial is that the capsules themselves, or the soft gels, sorry, are enteric coated, and that means that the ingredients are delivered to the site of where the problem is, the lower intestine. This results in improved efficacy. These oils are also known to support relaxation of the intestinal smooth muscle and help with colonic motility. So directions: you are going to look at taking one soft gel 3 times daily before meals, and there are 60 servings in 1 bottle of Intersol. Another option in the relief phase is Ulcinix, a stomach formula that combines various anti-inflammatory plant compounds like astragalus, Chinese licorice root, brown lily bulb, bletilla, and its application is predominant to help relieve occasional heartburn, acid indigestion, and to settle an upset stomach. It does this by supporting the stomach's natural protective mechanisms, helping to maintain a healthy microecology in the stomach and promoting a healthy stomach lining. Also like to highlight that we use advanced extraction technologies and analytical techniques to ensure that there's consistency from batch to batch so that you have predictable outcomes. Directions: one would take 2 tablets 20 to 30 minutes before a meal. There are 45 servings per bottle. Bottle contains 90 soft gels. I'd like to highlight, however, that this product does contain cuttlefish, and if the patient has any allergies to mollusks, one should avoid this product. And finally, Zinlori is a formula which utilizes the active ingredient zinc carnosine. If you recall from Module 1, zinc carnosine is a complex that has been found by numerous studies to support the underlying issues related to indigestion and heartburn and ulcers. Essentially, it is able to relieve gastric discomforts, heartburn, nausea, bloating, and an upset stomach. Research has also shown that it can protect the gastric mucosal cells, and it has been used successfully in Japan since 1994. Quite a unique ingredient, and it's this specific amino acid chelate, because of the strong bond that it has the prolonged release and therefore exerts more benefit when you take it in the specific form of zinc carnosine. So Zinlori is very easy to use. One only needs to take 2 tablets daily in order to reach the clinically effective dosage of 150 milligrams. So a bottle of Zinlori comes in with 60 tablets and is therefore a month's supply. And that brings me to the end of our product protocol for gut restoration. I'll see you in Module 2. Thank you.